Hi, my name is Jennifer Haas, and for our third presentation, I selected AI in the healthcare industry and specifically how hospital management is using artificial intelligence to further operations. I opted to research AI in the healthcare industry and how it is being integrated into hospital management because I have worked in healthcare for more than 20 years. And when it comes to technology and analytics advancements, it's stunning to see how much healthcare lags other industries. I'm interested in learning more about which hospitals are investing in AI and how they have gained momentum across their organizations for this type of advancement. Hospital leaders have an opportunity to drastically improve the quality of care with AI and to also enhance productivity. As the population ages and the average age of workers rise, healthcare struggles to find qualified individuals with the right skills to continue taking care of patients. Since the COVID-19 pandemic, healthcare staffing challenges have only been exacerbated. AI could provide a significant opportunity for hospital management to redeploy critical resources to areas where human skills are truly needed. The pandemic did provide an impetus for healthcare teams to advance their electronic platforms and patient engagement functions, as well as spawn a pivot in access to remote healthcare options. However, with marginal profits, hospitals must choose how to invest limited financial resources, and it is typically not in data analytics and advancing AI. This is unfortunate since it could ultimately streamline operations, mitigate staffing challenges, and advance more focused and higher quality treatment options. Despite overwhelming opportunities, there has been minimal adoption of AI in healthcare. AI-fueled legacy companies are simply non-existent, and many healthcare companies are at a level 1 on the capability model scale, and they are underachievers with regards to AI. Some healthcare systems may have started to reach a starter level 2 or path seeker level 3, but none have reached the higher scales of being a truly AI-driven company. The hospitals that are innovating care delivery models, such as the Cleveland Clinic, also tend to be the ones who are beginning to advance with AI integration. Most of the adoption is occurring in larger institutions located in bigger cities. One of the biggest rate-limiting factors for AI advancements in healthcare is due to data availability and data integrity. Medical data can be a challenge to access, and it is often collected locally in formats that are difficult to integrate systematically. The sensitivity of personal health data and regulatory requirements also pose additional challenges for data procurement and usage. Furthermore, hospitals typically have very low profit margins and as a result have limited financial resources to invest in data analytics technology. Job postings that require an AI background are an interesting way to see how different sectors are advancing with technology. And not surprisingly, healthcare ranks as one of the lowest industries seeking professionals with AI experience. Healthcare in the United States is more expensive than any other developed nation, and the level of quality does not offset the cost, as it is mediocre at best. The Institute for Healthcare Improvement developed a triple aim targeted improving healthcare. The triple aim targets improving the patient care experience, improving health populations, and reducing the cost of care. AI in healthcare offers an opportunity to achieve the elements addressed in the triple aim. Some of the most distinct benefits in AI hospital management can be realized with supply and pharmaceutical inventory management, as well as resource planning and allocation oversight. AI can be leveraged to improve the patient experience or to extend patient communication portals. It is also used fairly extensively for medical coding, and it can be deployed to help analyze radiology images and automate pathology reports. Additional use cases for AI include risk assessments and predictive modeling for specific patient populations, and it could be beneficial for those individuals requiring additional care management for complex medical scenarios. Cleveland Clinic and Cedars-Sinai offer two examples of how different healthcare systems have advanced AI in hospital operations. The Cleveland Clinic has long been a care innovator in the healthcare world, and they are again at the forefront of healthcare as they work to develop governance structures and frameworks that will enable them to successfully integrate AI. They have also invested in a 5-year partnership with PathAI to develop a pathology infrastructure for the next generation digital pathology diagnostics. Their goal is to advance the diagnostic accuracy of treatment options for patients, and they plan to use machine learning for insight at different disease stages to drive better outcomes. Part of this technology will use digitized pathology slides to enhance AI learning. Cedars-Sinai is extending their business to include an artificial intelligence division. Their goal is also to improve the quality of care they're providing, and their focus will be on driving conditions that present challenges in population health with the hopes of impacting disease statuses that are prevalent in the community. To start the AI division work with developing tools, they will look to support cardiac imaging, cardiac care, COVID-19 care, and clinical genetics. Previous algorithms have already proven very effective at discerning which patients are at higher risk for cardiac disease. There are numerous ethical and legal considerations with regards to AI in healthcare. Healthcare data is some of the most regulated in the country, and there are limitations put in place to protect patients' privacy. Any advancements in healthcare technology are highly scrutinized to ensure the highest elements of security are in place, and there are also concerns from healthcare providers and leaders about potential legal risks. Ethically, many people want to have a direct connection with their healthcare provider, and there's not yet enough trust in algorithms, especially by many of the clinical people. Given the limitations of healthcare data, it's often not available in large quantities to run testing, which only feeds the hesitation about building dependency upon it. In the future, it's highly likely that AI will continue to advance in healthcare, and over the next several years continue to offer opportunities for improved operational support, which will improve productivity and help to reduce costs. As technology continues to advance, healthcare device and data integration will be easier. And in the future, AI in healthcare will likely be used to develop healthcare ecosystems, which should help to improve communication and coordination across many distinct players in the healthcare world, such as insurance companies, providers, and research facilities. AI has the potential to drastically change the healthcare industry and how hospitals manage operations and patient clinical care. Ultimately, this will enable attainment of the triple aim with more resources to be appropriately applied with less waste, so the cost of care can be reduced, all while improving quality. Since healthcare overall is lagging in data analytics and AI, it will be a while before they catch up to other industries. And due to the regulatory challenges, healthcare also has additional data access and integration issues that must be addressed before AI can be truly leveraged for broader studies and applications. Given the job vacancies in healthcare and the ongoing need, I do not think there's a risk of jobs being eliminated. However, they may very appropriately be pivoted to those more directly needed. Healthcare companies have a huge opportunity to approach care in a transformational manner with AI. There are major benefits to reduce the overall cost of care, improve the quality. But the road to change for this industry is long and mired with challenges leaders will need to be willing to overcome. Breaking the current operational mold will not be easy, but the first few companies that figure it out will be positioned to set even higher expectations for those who have malingered.